down for a total knee replacement. I decided to look into medical tourism when I found out what it was going to cost in the States. We're self-employed, and our insurance for the last 8 or 9 years, we had the same policy. The rates kept going up, and we had to keep adjusting the deductibles up also, and we couldn't go anywhere else because I had knee surgery earlier, and it was a pre-existing condition, so I couldn't find another carrier. And finding out that it was going to cost $54,000 to have it replaced in Tulsa, I decided to start looking at other options, and someone told me to check abroad. Dr.Max Greig's name kept coming up on my searches over and over and over again, and that's when I decided to have my procedure done in Mexico. I'm 12 days out, and I'm doing great. I'm having no problems. I'm getting around. I'm just doing great. Besides the savings in cost, I found the hospital to be immaculate, very clean, had very little trouble with communications. Almost everybody knows English, and I know very little Spanish, but I was able to communicate very well. I was very pleased with the level of care, the cleanliness, just the caring. Everybody on staff just treated me like family. Going to Mexico, I had a lot of concerns because I didn't know the medical care down here until I did more research. Found that I would be going to a new state-of-the-art hospital, and this surgeon, Dr. Greig, was using the same equipment, same techniques that American doctors were. So that set me at ease. I just put it off too long. I should have done it much sooner. I've got a second chance now to get back into life with a new knee.